Since the 1880s, electrocution had been used to execute criminals. By the 1930s, a psychiatrist wondered if the same force that stopped a heart could restart a mind. This is electroconvulsive therapy, and it started with a trip to a pig slaughterhouse. Welcome back to the lab, my curious test subjects. I am your mad scientist, and today we are talking about the day modern psychiatric treatment was born. From watching pigs get their brains fried before their throats were cut. In 1938, an Italian psychiatrist named Ugo Cerletti walked into an abattoir to study how electricity rendered pigs unconscious, so butchers could kill them more easily. He was not there for a cooking class. He was preparing to send that same electrical current through a human brain. And somehow, it worked. So how do you figure out if electricity can cure insanity without killing the patient? You practice on animals first. Ugo Cerletti and his colleague Lucio Bini were two Italian psychiatrists obsessed with seizures. Cerletti had trained under the biggest names in neurology: Alois Alzheimer, Emil Kraepelin, people who literally have diseases named after them. Bini had a knack for machinery and a fascination with how to trigger seizures on demand. Both of them believed that seizures could treat severe mental illness. Other doctors were already using insulin comas and a drug called metrazol to induce seizures in patients. In clinical trial terms, that means chemically forcing the brain into convulsions and hoping for the best. But those methods were unpredictable and dangerous. Cerletti and Bini wanted something cleaner, something more controllable. So they started experimenting on dogs. They ran electric currents from the dog's mouth to its rectum. The results were not great. The mortality rate was high. Spoiler, the dogs did not do well. But then they tried something different. They applied the current only to the head, and the dog lived. Cerletti and Bini realized that electricity was only lethal when it passed through the chest and caused the heart to stop. If you kept it in the head, you could trigger a seizure without killing the subject. But they still were not ready to try it on a human. The idea was too terrifying. So Cerletti went to a slaughterhouse. He wanted to see how butchers used electricity on pigs. What he saw was fascinating. The electric shock did not kill the pig. It knocked it unconscious instantly, which made it easier to cut its throat afterward. Cerletti and Bini started practicing on pig heads. They adjusted the voltage, they timed the duration, they convinced themselves it was safe, and then they decided they were ready to try it on a person. And who did they choose for the very first human test? In 1938, police in Rome found a man wandering around the train station. He was incoherent. He seemed homeless. They brought him to the hospital where Cerletti and Bini worked. The two psychiatrists decided to use him as their first subject. In clinical trial terms, that means he had absolutely no idea what was about to happen to him. Some of their colleagues gathered to watch. Think of it like a product launch. Except the product was sending electricity through someone's brain and the beta tester had no idea he had signed up. Cerletti and Bini placed electrodes on the man's head. They administered a 70-volt shock for 0.2 of a second. The man began to sing. Then he sat up and said, "Not a second. Deadly." Everyone in the room went silent. Some of the observers were horrified. The subject had just told them, in his own words, not to do it again. Cerletti ignored him. Not great bedside manner. He immediately administered a second shock. This time, 110 volts for half a second. The man had a grand mal seizure. His entire body convulsed. Then he stopped. He recovered. And then he spoke clearly and lucidly for the first time. Over the next few days, Cerletti and Bini gave him more shocks. He improved each time. Within a week, he had made a full recovery. And here is the twist. He was not homeless. He was a farmer from the countryside near Milan. He had been treated successfully with metrazol the year before. He had just been traveling through Rome when the police grabbed him. Surprise, he had a name and a home. But none of that mattered to Cerletti and Bini. The experiment worked. Electroconvulsive therapy was born. And that is how modern psychiatric treatment was born. From watching pigs get electrocuted at a slaughterhouse and shocking a confused farmer who never consented to any of it. Cerletti and Bini went from butchering dogs to perfecting their technique on pig heads to strapping electrodes on a man pulled off the street by police. The subject literally said the words, "Not a second, deadly," and they shocked him again anyway. And somehow, this became a legitimate medical treatment still used today, the miracle of science. My curious test subjects. If this made you question everything you thought you knew about medical ethics, hit that subscribe button and let me know in the comments what experiment I should cover next. Until then, stay curious, stay skeptical, and maybe avoid train stations in 1930s Italy.